The pandemic here, the true financial impact of the global pandemic is still being calculated, but new data is showing it's expensive. After a 2-month battle with coronavirus, one patient says his medical bills totaled over $1 million.
National investigative correspondent Joce Sterman looks at the cost of COVID in the Spotlight on America.
Wow.
That's 181 pages of expenses.
You can call Michael Floor the $1 million man. After 62 days in a hospital and another 2 weeks in a rehab facility, he went home after beating coronavirus with a stunning souvenir, a $1.1 million bill.
Even though I knew it was going to be expensive, when you see it in writing and you see your name on it, it was like very startling.
Thousands of charges came with the monumental effort it took to save Floor's life. He says he had pneumonia, heart and kidney failure, had to be put on a ventilator twice. At one point, doctors told his family he wasn't going to make it.
I don't remember any of the calls, frankly. Hearing my wife describe it, it was difficult.
But Floor was lucky. Not only did he make a full recovery, thanks to Medicare, supplemental insurance, and congressional funding that helps hospitals defray pandemic costs, he only had to cover about $3,000 of that $1 million bill.
But you don't want to see people go into financial ruin just because they get sick.
No, absolutely not. They're fighting for their lives. And the last thing they need to worry about or their family needs to worry about is how much is this going to cost?
The cost of coronavirus varies from patient to patient. According to one national survey that looked at healthcare claims to estimate cost, the average charge for a COVID-19 hospitalization is $73,000 for someone without insurance. With insurance, that drops to about $38,000.
The entire globe is going to have a bill to pay for COVID.
Rebecca Owen is a member of the American Academy of Actuaries who works to evaluate trends and costs in healthcare. She says the impact on our bottom line, from taxes to insurance premiums, is still being determined.
There's going to be a lot of costs, not just in healthcare. States who have expanded Medicaid, that is going to cost more money, and Medicaid rolls are paid for by taxpayers. So what happens with premiums is one thing, but what happens with the entire system is that COVID's going to be expensive.
Which could mean more strain on the system and more shared costs. But as dollars are calculated, lives are rebuilt. Michael Floor, one of the country's first COVID-19 patients, is back in the gym, regaining his strength and treasuring the time he gets with family. But he's still keeping an eye on the mailbox.
I'm not expecting any follow-up bills that say this is what you owe. Keep my fingers crossed. I haven't seen anything that says paid in full yet.
I'm Joce Sterman for Spotlight on America.
Is there a story you think we should investigate? Call our Eyewitness News tip line at 869-2929.